vitamins. To start with vitamins, they are defined as organic molecules that serve a wide variety of functions in body structure and metabolism. These compounds are essential as they are not synthesized by mammalian cells and therefore must be supplied in the diet. And except for niacin, which is considered as a semi-vitamin as it can be synthesized in mammalian cells from the amino acid tryptophan. Vitamins are released from their food sources by digestion and become available depending on the type of food and agents that may chelate these compounds. Fat-soluble vitamins are absorbed in the lipid micelles after fat digestion, but factors that hinder fat absorption also affect the absorption of fat-soluble vitamins. Water-soluble vitamins and most mineral salts are absorbed from the small intestine either by active transport or carrier-mediated diffusion. We have one of the water-soluble vitamins, which is vitamin B12, and its absorption requires a specific transport protein named the intrinsic factor, which is a small glycoprotein secreted by the parietal cells of gastric mucosa. As mentioned in the introduction, we have two groups of vitamins, the fat-soluble vitamins and the water-soluble vitamins. Both groups differ in some intrinsic characters that will be discussed later. For all vitamins, we are going to describe their role and mechanisms of their actions, and also describe the manifestations of their deficiencies. We start with the fat-soluble vitamins, which is a group of 4 vitamins, vitamin A, D, E, and K. First, we start with vitamin A and vitamin A sources. Sources of vitamin A are animal and plant sources. Vitamin A or retinol is present in meat, liver, egg, and fish liver oil. The provitamin beta-carotene, which is a precursor of vitamin A, is present in plants like carrots, and it forms retinaldehyde. So, the retinoids or forms of vitamin A, and before we discuss these forms, we have the beta-carotene and other provitamin A carotenoids that are cleaved in the intestine by an enzyme, which is a carotene dioxygenase. And this cleavage yields retinaldehyde that is reduced to retinol. Retinol is then esterified and secreted in chylomicrons together with esters formed from the dietary retinol. So, the chylomicrons, which is one of the lipoproteins, serve as a transporter of retinol as one of the fat-soluble vitamins. We have 3 forms of vitamin A which are important for health. We have the retinal, retinoic acid and retinol, which is a key player that can be converted to other forms. As mentioned before, that we have three forms of vitamin A, which are retinol, and retinoic acid. But the parent structure is a provitamin A or carotene, which is converted to retinol inside the body. Beta-carotene is a carotenoid or pigment and present in yellow and orange foods and is a potent provitamin A. And as we mentioned before, the sources of vitamin A or retinol is present in meat, liver, egg, and fish liver oil, and the provitamin beta-carotene is present in plant sources like carrots and is responsible for formation of retinaldehyde. You can find more information about these topics in this site. Another structural function for vitamin A is that it is responsible for maintenance of the corneal epithelium, and its deficiency leads to a problem known as xerophthalmia. The second rule is that it participates in protein synthesis and cell differentiation. It supports reproduction and growth and supports immunity. It also has a role in bone growth and remodeling, combined with vitamin D and other vitamins like vitamin C. Is responsible for sense of some types of glycoproteins, and the beta-carotenes have an antioxidant activity. To continue with the vitamin A functions, we first mentioned that vitamin A has a role in the visual cycle, as in the retina. Retinaldehyde functions as a prosthetic group for the light-sensitive proteins opsins, forming rhodopsin in the rods and iodopsin in the cones. The antioxidant activity of vitamin A represented by the beta-carotenes, which are compounds that can dispose of free radicals and reactive oxygen species by scavenging them and suppressing their effect or opposing their actions, and so are referred to as one of the antioxidants like vitamin C and vitamin E. Beta-carotene is only an antioxidant at low concentrations of oxygen, but at higher concentration of oxygen, it is an autocatalytic or pro-oxidant. This means that its effect is reversed when the oxygen concentration is elevated. And as you see in the figure, that beta-carotenes can combine with molecular oxygen and form beta-carotene endoperoxides and epoxides. So they can dispose of or scavenge the reactive oxygen species. The deficiency of vitamin A is manifested as a deficiency of all the functions it supports. First of these, its effect on the eye. The first effect is known as xerophthalmia, which is dryness of the cornea and the conjunctiva. And xerophthalmia is an ancient Greek expression where xeros means dry and thalmus means the eye. So the whole expression is a dry eye, and is a medical condition in which the eye fails to produce the tears, which humidifies and moistens the cornea and conjunctiva, and moistens the eye and prevents drying. And this occurs due to keratinization of the lacrimal duct, and this leads to its obstruction with no tear production. Also, this dryness leads to conjunctivitis and inflammation of the cornea and increased epithelialization or keratinization. And vitamin A is one of the causes of the problem of xerophthalmia. Also, dry skin. The skin looks like the goose skin. And as mentioned, that it has a role in the visual cycle, so vitamin A deficiency leads to what is known as night blindness, which is a cause of blindness, of course, in the third world countries. For its deficiency in regarding the female and male reproduction, as we mentioned earlier, it has a role in reproduction and protein synthesis and cellular growth and differentiation. So the vitamin A deficiency is associated with increased incidence of abortions and neonatal death. Also some congenital malformations. In males, the vitamin A deficiency is manifested with keratinization of testicular epithelium and infertility. Also, there is increased incidence of infection that may occur in the respiratory tract due to roughness of the mucosa. In the urinary tract, this is also the case. And for bone and teeth, there is delayed growth and maybe some abnormal skeletal development. Deficiency of vitamin E is manifested for the cell as a whole by deficiency of the antioxidant activity, and it may lead to a development of cancer. The requirements for vitamin A in adults needs about 5,000 international units, which increase in pregnancy and lactation to about 7,500 international units, and the international unit is equivalent to 0.3 micrograms of vitamin A. For the fat soluble vitamins, toxicity is a high risk when the persons or patients administer large doses of these vitamins. For the vitamin A toxicity, there is only a limited capacity of the body to metabolize vitamin A, and excessive intakes lead to accumulation beyond the capacity of intercellular binding proteins, and the unbound vitamin A may cause membrane lysis and tissue damage. And as you know that the fat-soluble vitamins may be combined with proteins or lipoproteins and may be stored in fatty tissue. So the symptoms of toxicity may affect the central nervous system and manifested as headache, nausea, ataxia, and anorexia, and may be associated with increased cerebrospinal fluid pressure. In the liver, they may be hepatomegaly and some histological changes, as well as hyperlipidemia. Calcium homeostasis also affected. Calcium homeostasis is also affected. There is thickening of long bones with hypercalcemia and calcification of soft tissues. And the skin, as we mentioned, becomes dry with excessive dryness and desquamation, and maybe loss of hair or alopecia. Other manifestations may occur depending on the extent of toxicity and the dose that the patient administered. And this ends this brief discussion about vitamin A. Vitamin D. The second member of the fat-soluble vitamins is vitamin D. The sources of vitamin D are also animal and plant sources. We have another source is ultraviolet radiation. Before we discuss the vitamin D, it's worth mentioning some high-risk individuals, which are the dark-skinned individuals and older adults, also breastfed infants from vitamin D deficient mothers. Some points we should remember or keep in mind is that sunscreens with a sun protection factor of 8 and above prevent vitamin D synthesis. So sunscreens should be applied only after enough time has been elapsed to provide sufficient vitamin D synthesis. And exposure to the sun does not cause vitamin D toxicity. And so for most people, exposing the hands, face and arms on a clear summer day for about 15 minutes a few times a week should provide sufficient vitamin D. Dark-skinned people require longer times for sunlight exposure as they have excess melanin, which is a skin pigment that is a natural sunscreen. Dietary recommendations assume that no vitamin D is available from exposure to sunlight. So people who don't have some outdoor exposures or who live in northern or predominantly cloudy climates need to pay attention to their dietary sources for vitamin D. For the sources and requirements of vitamin D or cholecalciferol, the requirements of vitamin D about 200 international units up to the age of 50 years, but beyond this age, these requirements are doubled or tripled to about 600 international units. The sources of vitamin D, as we mentioned earlier, the first of which in mammalian cells is ultraviolet irradiation, which forms cholecalciferol or vitamin D. The process of vitamin D synthesis or cholecalciferol or vitamin D3 starts on the skin, starting with cholesterol, which is converted to 7-dehydrocholesterol, and the B ring of this 7-dehydrocholesterol is opened by the effect of ultraviolet rays, ending with vitamin D3 formation. This is also what happens with ergosterol, with ultraviolet rays forming vitamin D2 in plants. So it takes 3 stages for the vitamin B2 synthesized, starting with cholesterol under the skin and 7-dehydrocholesterol, where this cholecalciferol passes after forming the vitamin D3 to the liver, where it is hydroxylated at the 25 carbon by a 25 hydroxylase in the liver. This is followed by another step of hydroxylation by 1-alpha hydroxylase in the kidney. This process is controlled by the parathyroid hormone, which is responsible for activation of the 1-alpha hydroxylase in the kidney. This enzyme is also activated by other hormones, which are estrogen and prolactin and growth hormone. And this is important in females during gestation and during the period of lactation. The 1,25-dihydroxycholecalciferol, or the active form of vitamin D, performs many functions regarding the calcium or controlling calcium level in blood. It's responsible for stimulating sense of calcium binding proteins and alkaline phosphatase, and responsible for increasing intestinal absorption of calcium, which consequently leads to elevation of plasma calcium ion concentration. And this is the role of vitamin D in control of calcium levels in blood. So, summarizing these important steps, the one that occurs in the liver, where cholecalciferol undergoes 25 hydroxylation to yield 25 hydroxycholecalciferol, and in the kidney it undergoes further 1-alpha hydroxylation to produce the 1,25-dihydroxycholecalciferol or vitamin D, and its production in the kidney is catalyzed by the 1-alpha hydroxylase that is under control of the parathyroid hormone, and also the estrogen, prolactin, and growth hormones. The 125 dihydroxycholecalciferol or vitamin D induces the production of calcium binding proteins. These proteins sequester calcium and buffer the high calcium levels in blood, which occurs during the initial absorption, and allow calcium to be absorbed against a high calcium gradient. And as we mentioned, that estrogen, prolactin, and growth hormone have a role in stimulating the 1-alpha hydroxylase, the step that occurs in the kidney, thus increasing calcium absorption during pregnancy, lactation, and growth. And this secures the sufficient calcium during these periods. Many of the biological functions of vitamin D are related to calcium and its regulation or normalization or maintenance of sufficient calcium levels in blood. And this is done by three mechanisms. Vitamin D increases calcium absorption from the gut, and this is a role exerted on the intestine. It increases intestinal calcium absorption. In the kidney, it increases calcium reabsorption, and it has a role in bones. It releases calcium in the bloodstream in response to low calcium levels. So it is responsible for stimulating osteoclastic cells in bone or bone mobilization or bone resorption. This process of bone resorption is in equilibrium with the process of bone mineralization, and this role is also played by vitamin D. Vitamin D is also responsible for absorption of phosphate from the intestine and increasing phosphate reabsorption from the kidney. So from the previous discussion, we found that, or we can notice that vitamin D deficiency may be linked to manifestations of calcium deficiency. And these manifestations are manifested in children and in adults. In children, it's manifested as rickets or softness and deformities in bone skeleton, and in adults it's manifested as osteomalacia, represented by weak bones, bone veins, and increased bone fragility and fractures. In children, the manifestations appear in their skeletons, where the skull has a box shape with delayed closure of the anterior fontanelle of the skull, bowed legs, and we can feel the rosary beads in their thorax, where the ribs have some thickenings as a costochondral junctions, which can be felt as rosary beads. So these deficiency manifestations, the rickets, in which the growth plates are affected, and occurs in children. There is bone thinning or hypoplasia, with decreased bone mineralization or hypocalcification of bones and enamel of teeth. And the osteomalacia where there is incomplete mineralization of osteoids and occurs in adults, which are poorly exposed to sun, or females which have repeated pregnancies and lactation. The last point is vitamin D toxicity, which is most likely to occur when vitamin D is consumed in excessive amounts through supplementation. The excess administration of vitamin D raises blood calcium levels, resulting in calcium precipitation in soft tissues or calcinosis, and stone formation in the kidneys, where calcium is concentrated or becomes concentrated in an effort or trying to be excreted. So there is frequent renal stones. And this ends the lecture for vitamin D. Vitamin E is one of the antioxidants associated with cell membranes or present in cell membranes. It is a lipid-soluble antioxidant and functions in maintaining the fluidity of cell membranes. And regarding the structure, we have the vitamin E vitamers, which are alpha tocopherol and tocotrienol. The two families of vitamin E are with different biological potencies. There are the alpha or the E1, the beta or E2, gamma or E3, and the delta tocopherol. Deficiency of vitamin E is rare, but for the sources we have animal and plant sources. It's present in vegetable oils, which are rich sources. Also the green leafy vegetables. The meat, eggs and liver also contain moderate amounts of vitamin E. The daily allowances of alpha tocopherol of vitamin E is about 15 milligrams for adults, and the requirements of the vitamin as other vitamins increase, but in this case or the case of vitamin E, it increases with increased intake of polyunsaturated fatty acids. The functions of vitamin E. It has an antioxidant function as it prevents the formation of peroxides in polyunsaturated fatty acids. And as mentioned earlier, vitamin E is a major lipid-soluble antioxidant in cell membranes and plasma lipoproteins. The main function of vitamin E is as a free radical scavenger. It's responsible for scavenging antioxidants, or is responsible for scavenging as we mentioned earlier, that vitamin E deficiency is rare, but deficiency may occur and manifest as hemolysis of RBCs and anemia, which is common in newborn infants. Dietary deficiency of vitamin E in human beings occurs in patients due to their inability to absorb or transport the vitamin, as in cases with severe fat malabsorption, cystic fibrosis, some forms of chronic liver disease, and maybe in obese patients receiving drugs that inhibit pancreatic lipase that is responsible for digestion of lipids. So this vitamin is lost with undigested and unabsorbed fats. Hemolytic anemia, due to the abnormality or fragility of membranes as a result of lipid peroxidation, occurs in premature infants due to their inadequate reserves of vitamin E. Also, there is some sort of muscle breakdown due to the nerve and muscle membrane damage, which occurs in severe cases of vitamin E deficiency. Vitamin K, or the last member of the fat-soluble vitamins. The structure of vitamin A, we have many forms of vitamin A, natural and synthetic. We have the vitamin K1 or phyloquinone, the vitamin K2 or menaquinone, which is synthesized by the intestinal bacterial flora in the intestine. The synthetic forms are menadione and menadione acetate, which are synthetic water-soluble forms used as drugs in case of vitamin K supplementation. The vitamin K sources are many. So vitamin K is found in cabbage, turnips, spinach, egg yolk, and liver, and also in broccoli. Also, there is the bacterial source from the gut. These bacteria synthesize vitamin K in the intestine, which is absorbed and used. The requirements for vitamin K is about 120 micrograms per day for adult males and a lesser amount for females. Vitamin K is involved in many functions. The first and most important of these functions is the synthesis of blood clotting factors in the liver. These factors are prothrombin, factors 7, 9, and factor 10. Vitamin K is responsible for activation of these factors. This is by the following. The gamma carboxyglutamate residues in these clotting factors constitute the binding domains for calcium ions through which they can bind erythrocyte membrane phospholipids. The modification of the gamma carboxyglutamate is one of the post-translation modifications which occurs in the liver after synthesis of these proteins in the liver. When the anticoagulant factors bind calcium, they inhibit coagulation. The anticoagulant factors as citrate used as an anticoagulant in the laboratory with blood specimens, or dicumarole, which is an antagonist of vitamin K used to inhibit blood coagulation in patients at risk of thrombus formation. Warfarin is an example of these drugs that inhibits the active prothrombin synthesis by inhibiting vitamin K dependent carboxylation of glutamate to gamma carboxyglutamate. So vitamin K is an important cofactor for gamma carboxyglutamate formation, which is an important residue in the proteins or the blood clotting proteins. The requirements of vitamin K, as mentioned before, is about 120 micrograms per day for adult males and 90 micrograms for adult females. But a point has to be remembered. This point is regarding some foods that are not preferred for high-risk people or people with a history of thrombosis. These foods are taken like broccoli, cabbage. They are frequently used in salads, so these foods are better be avoided due to their richness in vitamin K. Continuing with the functions of vitamin K, vitamin K is important in the process of bone synthesis and other calcium binding proteins. As we mentioned, it has a role in the carboxylation of glutamate to gamma carboxyglutamate. And this includes the blood clotting factors and osteocalcin and the matrix gamma carboxyglutamate proteins in bones, nephrocalcin in the kidneys. So the gamma carboxyglutamate containing protein is a residue that bind calcium and is important in bones and in blood clotting factors. So through this osteocalcin, vitamin K stimulates bone formation and decreases bone resorption. And deficiency will be associated with weak bone formation due to reduced osteocalcin, which is a calcium binding protein in the bone matrix. Other vitamins with similar functions, as also vitamin K, is the vitamin C, which is required for bone formation. Also vitamin A and vitamin D are of specific importance for bone metabolism, especially during bone formation. And this is mentioned in other lectures. The mechanism of vitamin K in activation of prothrombin. As we know that prothrombin is one of the blood clotting factors, and the prothrombin precursor contains 4 to 6 glutamic acid residues. And vitamin K is responsible or is a cofactor for the carboxylation reactions that occurs for these residues, converting them into gamma carboxyglutamate to convert the protein into an active thrombin. So, as you see, that vitamin K is a cofactor during the carboxylation reaction of glutamate. Gamma carboxyglutamate residues in clotting factors constitute the binding domains for calcium ions through which they can bind erythrocyte membranes and phospholipids, and these modifications, as mentioned, are post-translation modifications and occur in the liver after the protein is synthesized. The vitamin K antagonists, we have the dicumarol and warfarin which are antagonists of vitamin K. Dicumarol is found in some plants fed to animals, and moldy sweet clover, and is responsible for the sweet clover disease in animals. Warfarin is a synthetic product and used as a rat poison. These anticoagulant factors bind calcium, so they inhibit coagulation, as what occurs with blood samples in the laboratory when we use citrate. But dicumarol, as an antagonist of vitamin K, is used to inhibit blood coagulation in patients who are at risk of thrombus formation. Warfarin, as an example of these drugs, inhibits the active prothrombin synthesis by inhibiting vitamin K-dependent carboxylation of glutamate to form gamma carboxyglutamate, which is a calcium binding residue in these proteins. Thus, administration of vitamin K will bypass the coumarin-induced inhibition and restores the process of blood coagulation. Vitamin K deficiency is manifested mostly as impairment of blood clotting, which occurs in some cases as newborn infants. These newborn infants have no bacteria in their intestine in their first days, so circumcision in newborns or any other operation is done either immediately after birth or is delayed 2 to 3 months later to guarantee the presence of the bacterially synthesized form of vitamin K. Also, cases of persons which use antibiotics or the long use of antibiotics, which kills bacteria flora in the intestine. This is also associated with biotin deficiency, which is one of the B vitamins. Also, liver disease. As you know, as the liver is a site of synthesis of prothrombin. Prolonged use of anticoagulants as dicumarol, an example of which is warfarin, which inhibits vitamin K assisted activation of clotting factors. And as mentioned earlier, that administration of vitamin K will bypass the coumarin-induced inhibition. If you like this lecture, please hit the subscribe button and give your feedback in comments. The link for this lecture will be in the description below this video, and you can find other details in the website provided.